and a lot of things have been coming in, and we're very grateful for Alvin, and we'll continue to push for more. And then, having said that, once again, we'd like to congratulate the Vice Chancellor for providing the enabling environment for us to be here today. The Dean of the Faculty, distinguished lecturers, supposed to put in a lot so that the students get to where we are today. Parents, distinguished invitees, I also wish you well, and all humility, I wish you the very best for the Faculty of Veterinary Medicine, Ahmadu Bello University, Zaria. Thank you very much.
Thank you, everybody. Mr. Chairman, the special guest of honor, other dignitaries of the high table, distinguished graduates, Mr. Barrow, ladies and gentlemen, at this point, it is my honor, with respect, to invite for her presentation, that is the guest speaker, pharmacist Aisha Isiaku, who heavily represented by pharmacist Professor guest speaker.
Let me be sure of my video.
The Vice Chancellor, heavily represented by the Deputy Vice Chancellor, Chairman of the Occasion, Dean of Faculty of Pharmaceutical Sciences, the Registrar, Special Guest of Honor, other members of the high table, our erudite lecturers, our expectant, beautiful graduates. I wish to stand on the existing protocols. Thank you. So it's a pleasure and an honor for me to stand before you. 19 years ago, I was sitting over there, and I can remember I was so happy. I can't even remember the theme of my graduation. I hope it will be the same with you. So I'm standing here representing the Executive Secretary of Kaduna State Health Management Agency, Pharmacist Aisha Isiaku, and I'm sure a lot of you know her. She's a lover of pharmacy profession. She sends her regrets. She really wanted to be here, but unfortunately she's away on an assignment which took outside the state. So she sends her regrets and her apologies. So I'm going to give her a presentation on her behalf on the team stepping into the future. It's a very good thing because you're all going to step into the future and see what the future looks like. So the whole discussion is going to be around pharmacy practice and innovation in the digital age. So by way of introduction, pharmacy as a profession is an important component of modern healthcare. According to the World Bank, more than 80% of patient care encounters involve use of medicines. And we all know pharmacists are custodians of medicines, so therefore you're directly involved in modern healthcare. So it sits at the intersection of science, healthcare, and humanity. According to evidence synthesized by Cochrane collaboration, pharmacist-led interventions can reduce medication errors by up to 50% and improve treatment adherence by 15 to 20%. Globally, pharmacists are among the most accessible healthcare professionals and consistently ranked as one of the most trusted professions. According to the WHO, community pharmacies are often the first and most frequent points of contact with the health system, with many patients visiting pharmacies up to 12 times more often than primary care providers. Pharmacies are entrusted with the responsibility of ensuring safe and effective use of drugs. According to them, pharmacists consistently rank among the top 5 most trusted professions, with over 2/3 of respondents rating them as highly honest and ethical. So, as a pharmacy professional, we are at a moment of transition. The question is, what will it mean to be a pharmacist in 2020? Today marks a transition from learning pharmacy to practicing pharmacy. You are entering the profession at a time of rapid technological transformation. Today, the pharmacist of today is no longer just a dispenser, but a strategist, an innovator, data analyst, policy maker, and health systems leader. You are not just stepping into pharmacy profession, you are stepping into the future. The change of face of pharmacy practice now sits at the intersection of healthcare, technology, and policy. So the pharmacy profession has changed from product focus to patient-centered care, from manual systems to digital and automated workflows, from isolated practice to multidisciplinary teams, from reactive care to preventive and data-driven care. So pharmacy of today in digital age is patient-centered, where digital technologies are transforming the way health services are delivered and managed, with the potential to improve access, quality, and quantity. This is an information from WHO. So there's also electronic prescribing and dispensing systems now in the digital age. There's telepharmacy and remote pharmaceutical care, virtual pharmacies and remote consultations, wearables and Internet of Things for adherence and health monitoring. The impact of pharmacy in the digital age will be telepharmacy services have been shown to reduce medication errors by up to 32%. Patient satisfaction with telepharmacy exceeds 85% in one. This is found in American Journal of Health System of Pharmacy. There's also data intelligence and precision medicine. Data analytics for demand forecasting and patient safety, artificial intelligence in supply chain and clinical decision, predictive analytics for patient health. These are all new innovations in pharmacy profession. We also have pharmacogenomics, where it tells us therapy to genetic profiles, and the impact is artificial intelligence. There is advent of artificial intelligence, drone delivery services, which already lives in Nigeria here, where drones are used to transport medications from a certain distribution center to the healthcare facilities within the state. So automation, security and system efficiency, digital inventory and logistic platform. Now it's not about using tally cards to enter and keep records of your medication. Now we have warehouse management software where you do your digital inventory and it's more accurate and provide a logistic platform for decision making. So there is also blockchain for medicine traceability and anti-counterfeiting, which is very critical in combating substandard drugs within the country. So WHO estimates that 1 in 10 medical products in low and middle income countries is substandard or falsified. And in Nigeria, counterfeit medicines have historically accounted for up to 30% of drugs in circulation. So imagine embracing blockchain and digital traceability for us to be able to combat this menace that is affecting the pharmacy profession. So lessons from public health pharmacy. Digital systems improve availability of health commodities. It also improves affordability, accessibility, and accountability. So overall of this will lead to equity distribution of health commodities for universal health coverage. Data visibility prevents stockouts and expiries. Technology strengthens transparency and governance. Pharmacies now influence policy, finance, and health scrutiny. These innovations are already transforming public health supply chains, improving efficiency, transparency, and patient outcomes. Nigerian pharmacists have the opportunity to lead Africa's digital revolution by embracing these tools. The future of pharmacies must therefore be clinically sound, digitally competent, and ethically grounded. So new roles for modern pharmacies. Graduates, you should see yourselves as change management players, ready, digital ready healthcare professionals, public health and supply chain experts, innovators and problem solvers, ethical guardians of medicines and data, entrepreneurs, policy advocates, strategic thinkers, and integrated decision makers. So, as you go out there are certain skills you must build for the future. Beyond the degree you have acquired now, there is need for you to learn change management, digital literacy and health informatics, data interpretation and systems thinking, leadership, teamwork and communication, ethics, health and AI. Continuous professional development and improvement is key to success of your profession. So your certificate qualifies you, but your skills and expertise will sustain you. Adopt technology and innovations. Tools and gadgets is about improving access, quality, and outcomes. Young pharmacists must be solution-driven and not job seeking alone. Start small. Improve our process, digitize systems, redesign workflows. So a challenge to the graduate. As you take the vote today, embrace lifelong learning, adopt change management, be adaptable, ethical, and innovative. Use technology to serve humanity, uphold the honor of the pharmacy profession, be ambassadors of excellence for ABU and Nigeria. In conclusion, I would say the future of pharmacy is digital, but its soul remains human. Step into the future with competence, courage, and character. Congratulations once again. morning and welcome to the noble profession of pharmacy. Thank you very much.
Thank you. What a wonderful presentation and advisory tips, if I may comment. I recognize the presence of the acting university security officer, Madam Ashiru Tizongo, who has said is but on pressure, I did not recognize it. I'm sure you're hearing useless and all this. The rate at which we are being intruded is honestly unprofessional. What is ideal we are? So please, we have done that. Put more pressure on me. Mr. Chairman, distinguished ladies and gentlemen, we are now going to have a complementary segment of this presentation that has been given, which is the speech by the Registrar, Pharmacy Council of Nigeria, Pharmaceutical Graduands, Registrars. We represented the classes. So we appreciate you for your time with us this morning. We have courses for now to leading this event in this section. Special guest of honor, Professor Ahmadu Bello, my roommate, teacher. It's also the registrar and the the chairman of the association, Professor Bello. Thank you, Chair this faculty, the president of the ABR, with respect to I also ask question when I was in the system that we have been lecturing about this. Other distinguished activities of faculty, the parents, the guardians, and graduates, my colleagues from the Pharmacy Council of Nigeria. Indeed, it is my pleasure to felicitate the university community, the Ahmadu Bello University, Zaria, in particular the Faculty of Pharmaceutical Sciences and the graduate in this occasion of taking the Induction Ceremony of 106 graduates and bachelor of the faculty. We are all aware these graduates, they work very hard. They show determination, they show resilience to have attained this particular state of today. I want to particularly also appreciate your parents who stood by me compulsory education. With that, I will begin to guide and protect our laws as the statement of the professional pharmacy. Distinguished ladies and gentlemen, this promising young men and ladies gathered here today have just completed the process of their training as professionals.
That's true.
As professional pharmacy. This is one of the criteria among other requirements stipulated by the law establishing the pharmacy council, which has to be fulfilled for the practice of the profession. I urge you to maintain high standards and leadership qualities as practice, as well as enable the multi-professions for the achievement of excellence in the provision of pharmaceutical services. I'm sure you had social listening. Which of us is going to the conclusion why we are teaching? We accept who are expected in PCN Academic Center and the online institute of PCN approved research. Take note that this internship is and it's a period of preparing for the future opportunities within the practice framework space pharmacy profession. As pharmacists, we expect you to trust the ethics of pharmacy of the practice of the profession. The code of ethics clearly describes your professional responsibility to the patients, as well as your pharmacist and other healthcare professionals, your employers and so compliance with this code of ethics is indispensable in the practice of pharmacy. After being successfully inducted, after your internship processes, you will be fully registered as a pharmacist. I want to assure you that you have great opportunities to practice in different areas of pharmacy. Whichever that interests you, you can't go about it. Let me emphatically state again, pharmacy is another profession and provide opportunity for pharmacists and graduates prospects of practicing in different fields, which could be in the industry, it could be. When I say community pharmacy, it does not cover community pharmacy. Importation, distribution, wholesale, as well as community practice as a pharmacist. Today, we are taking it higher. As you may be aware, we are closing down all open world marketing. The purposes of improving the practice environment. Again, that comes with a lot of challenges because those opportunities that are being opened are taken up by pharmacists. Therefore, we have several opportunities. We can also work in the hospitals if we choose to. We can choose also to be the academic, in the research, in administration, working in the ministry, and other areas. Particularly, we have a new area today, which is the pharmacy practice. And indeed, the regulation for control for later following the pharmacy practice is currently on. Incidentally, the topic of keynote speaker today centers on digital, the interface between digitalization and pharmacy practice. of Nigeria, we currently taking full control of this particular piece, and we urge you to take advantage of this new opportunity, the digital pharmacy. That's what across various practice sectors, they can inform you that the customer is conduct in the act. So we are referring conduct as this seriousness that can has provided for the establishment of an investigative panel, as well as this tribunal as mechanism for handling issues of operational. Please keep up for ethical misconduct, particularly the register and lawsuit, which has great potential to carry the pharmacy. The front line, offering professional services, information on drug use, working with other healthcare professionals as well, especially in public, like I continue to regulate your authorities on this occasion of admission into the practice of pharmacy profession. You hope and the profession does not set you free from the federal guidance. They are oversight responsible. Unfortunately, through the second and lifelong phases of your practice as a school of life. An advice to you, my new colleagues, have the long project. What I mean is, when you pick from among the various opportunities, about a situation whereby you embark on one, after some years you drop that and want to try another. That will only amount to time waste. What is very important when you look at any of these opportunities and consider one this is you the most. Back on the 6 guidance, 6 membership, and I can assure you that I take the key of it. So as much as possible, program like what I can call abandoned projects. Don't waste your time. It is my wish and prayer as you have a mutually satisfying practice experience as pharmacists. You are welcome to our work. You are welcome to the world of pharmacy. Again, I congratulate you. Thank you very much.
I think very soon the registrar will be back to that time. When by the program, distinguished ladies, is a presentation of graduates, which will be done by the Dean, Faculty of Pharmaceutical Sciences, together the Registrar, Pharmacy Council of Nigeria. So we are all today.
Mr. Registrar of the Pharmacy Council of Nigeria, sir, I have the honor to present to you these graduates who have successfully completed a course of study in pharmacy and are worthy of induction into the global profession of pharmacy.
Let me ask hope each of you have the own certificates. You all have. Are you prepared now to take the oath? Okay. We go like this. Whatever. Oath, I expect you to mention your name, be the one taking the oath. After which you proceed. Can we go now? Are we set? I can't hear you. Are you set? Okay. Let's go.